Herkese merhabalar, ben Doktor Yaşar Başa, üroloji ve androloji uzmanıyım. Biliyorsunuz penil protez yani mutluluk çubuğu ameliyatını sıklıkla uygulayan kliniklerden bir tanesiyiz. Mutluluk çubuğu ameliyatını uygularken de birden farklı kesiden ameliyat yapabiliyoruz. İnfrapubik teknik dediğimiz penisin üst kısmından veya peniskrotal dediğimiz penisin alt kısmından, penis ve yumurtalıklar arasından veya subkoronal dediğimiz sünnet hattından bu ameliyatı gerçekleştirebiliyoruz. Özellikle infrapubik teknik dediğimiz penisin üst kısmından yaptığımız ameliyatlarda hastalarımızın çok ciddi bir çekincesi var. Bunun sebebi de acaba his kaybı yaşar mıyım diye bir hastanın deneyimi çok ciddi olumsuzluk etkiliyor. Bugün dünyanın ve Avrupa'nın en önemli infrapubik teknik uygulayıcılarından olan Profesör Doktor Gabriele Antonini bizimle. Onunla kısa bir röportaj gerçekleştirdik. Hem tekniğin avantajları hem his kaybıyla ilgili bir risk var mıdır diye bir İngilizce videomuz var. Videoyu altyazılı olarak izliyor olacaksınız. Herkese keyifli seyirler diliyorum. Aslında cerrahın tecrübesi varsa infrapubik tekniğin ne kadar güvenli olduğu ile ilgili eğlenceli bir bilgilendirici bir video çekiyor olacağız. Umarım sizler de eğlenirsiniz ve dünyanın en önemli isimlerinden de bunları duymanızın sizi daha çok rahatlatacağını düşünüyorum. Herkese şimdiden iyi seyirler. Hello everyone, I'm Dr. Yaşar Başa, Doctor of Urology and Andrology. Today we are with a great surgeon, Professor Gabriele Antonini from Rome. He is one of the highest volume implanter in Europe. He is using infrapubic technique for penile implantation surgery. For our patients and for many patients, they wonder about results of and benefits of penile implant surgery with the infrapubic technique, and they have fear of getting loss of sensation after the surgery, especially in Turkish society. For Turkish patients, you know, there is a patient that had loss of sensation due to surgery and has many fear about those, especially in YouTube. And today I would like to ask Professor Gabriele Antonini about his experience in infrapubic approach and his results about the infrapubic approach, the benefits of infrapubic approach. We really appreciate him to be here with us because we were in Rome, we get some education, he teached us about the infrapubic technique. We really appreciate because on behalf of being a great surgeon, he's a great professor and teacher to teach his technique. Thank you for being with us. I would like to ask you about the benefits of infrapubic technique and the results and loss of sensation about the infrapubic technique.
Okay, thank you very much for this kind invitation. It's a pleasure for me sharing my experience. I think today the best surgeon in penile prosthesis needs to know both the approaches, pinoscrotal and infrapubic, because many times you have to decide to switch from one to the other. But in my personal experience, now I'm doing all my surgeries with infrapubic approach because the time of the surgery is nothing, 15 minutes. The incision is the scrotum is a part very rich of bacteria and the risk to having an infection growing up with the bacteria. And without the incision on the scrotum, the patient hasn't pain on the scrotum and can start with the activation of the prosthesis after 7 days. About the less sensation is not true because the technique is very similar to the pinoscrotal. The dilatation of the corpora is very similar to the pinoscrotal approach. Obviously, it depends on the expertise of the surgeon. If you don't recognize the neurovascular bundle on the penis, on the dorsal part of the penis, you can have some troubles. But if you are good, if you don't touch this neurovascular bundle, the risk to having some problem on the sensibility and losing sensibility with this kind of technique is impossible. But I repeat, if you are a complete surgeon, if you are very skilled in this field of andrological surgery, you need to know both the approaches.
Thank you so much, Professor. Really, your technique is very smooth. When we started the surgeries, we had many benefits and vision changed after your course being in Rome. Thank you again being with us. And I think it's very clear and obvious to be an expertise surgeon and for both sides, but infrapubic approach, very aesthetical and there's no cables between penis and scrotum. It's really has very great appearance. You can check our Telegram channel both for before afters, and he has many good results. Even when we were there, we had 6 surgeries there. All of them was really perfect, and we saw very aesthetical results after. For many times he sends us photographs of surgeries, and it was amazing. After that we decided to change our incision to infrapubik, and we are doing both. Thank you for being with us. I hope all minds are clear after this video. If you are trying to get surgery about penile implant, you can choose your direct way with your surgeon, but the expertise is the most important point. Have a good day.
Thank you.